Assalamu alaikum and greetings, everyone. How are you today? Mentally, emotionally? Mental health issue has become a major concern nowadays, especially during the pandemic COVID-19 outbreak. The involvement of mental health professionals are very important for psychological assessment and treatment. In education sector, like in school, at least one counselor has been placed to support the psychological well-being of the student. With this limited number of counselors, they are facing many constraints in implementing their role, such as overburden of workload and not able to efficiently conduct the preliminary assessment of the student due to the lack of skill. So, we were thinking, how can we help them? How can we integrate technology in assisting the counselors to do their job efficiently? With that, we introduce to you the apps called A Helping Hand. These apps will assist counselors to conduct efficient psychological assessment and also to reach out more professional out there.
Hi everyone. Now this is time for me to explain about our project objective. So we have three main objectives, which are to serve as a reference point for common observable signs associated with decline of mental health and psychosocial well-being among students. Number two, to create an application that enables counselors to carry out preliminary psychosocial evaluation towards the need for social intervention. And lastly, number three, to identify relevant mental health practitioners based on the identified risk level.
So the application is really simple to use. Basically, the counselors will be able to use this application. First is to identify should some student demonstrate a decline in their psychosocial well-being. So that particular page, we would outline the characteristics as well as observable signs to indicate a decline in psychosocial well-being of individuals. Okay, so this application could be used as a reference for these counselors. And the second part of this, should they have observed and identified some individuals to be considered as high-risk individuals, they could also use this application for preliminary assessment. So to engage in this assessment, the counselors, after they log in, include some information about the individuals. And then after that, they will provide some input regarding their psychological well-being as well as their social support. Okay, so the psychological well-being, the questions are based on the DAS instrument, where questions regarding depression, anxiety, and stress of the students are included. We also take into consideration social support, because this is also another important factor that would contribute towards one's psychosocial well-being. So after counselors input all this information, a total score will be calculated by this application, and it will put the student on a level to see to what extent is their level of well-being, psychosocial well-being. Should the student do not show that they have healthy psychosocial well-being and they are at risk, this application also suggests who should they refer to for further assistance. So this application also support counselors to link these high-risk students to professionals near them to get further support. So essentially, this is how the application works.
In conclusion, previous studies have shown increasing and alarming incidents of severe depression, stress, and anxiety cases among students. These mental health issues and unstable psychosocial well-being have also been found to negatively impact the students and their relationship with others. Our Helping Aid Act has been created purposely for an early detection and intervention for the mental health status and social support status of the students. The process of identifying students' mental health and psychosocial well-being can be made easier with this application due to its simple and straightforward approach. Our hope is to create a high-fidelity prototype and to be able to test our app in a real school setting. And after rigorous testing and improvement, we wish to commercialize this app for the usage of counselors in the schools and also in tertiary institutions, also in the government and non-governmental agencies. We also anticipate that our Helping Hand app can be used as part of general assessment like personality tests or also aptitude tests during career days or orientation days. This will allow early detection and intervention to take place. And finally, we would like to thank our institutions and superiors for their continuous support and encouragement for us to develop this innovative idea. Special thanks to all our counselors who have served as our informants and inspired us to develop this application. Thank you.